Can brain scans diagnose OCD accurately? Imagine trying to diagnose a complex mental health condition like obsessive-compulsive disorder using just a picture of the brain. While brain scans are fascinating and show us a lot about how the brain works, they are not currently reliable enough to diagnose OCD on their own. Brain imaging techniques like functional MRI, structural MRI, PET scans, and SPECT scans can reveal differences in brain activity and structure in people with OCD. For example, these scans often show abnormal activity in areas like the caudate, nucleus, and anterior cingulate gyrus, parts of the brain involved in controlling habits and decision-making. Researchers have found that in OCD, there is often increased blood flow and altered neural activity in these regions compared to people without OCD. However, these findings are consistent across groups of people but are not specific enough to identify an individual with OCD. The same brain regions can show similar activity in other mental health conditions, which makes it hard to tell OCD apart from other disorders just by looking at a scan. Studies that try to use machine learning to classify OCD based on MRI data have achieved only moderate accuracy, around 75%. That means they are not precise enough to be used as a standalone diagnostic tool in a clinical setting. Brain scans are more useful for understanding how OCD works and for research purposes. For example, they can help scientists see how brain activity changes with treatment or in severe cases where other therapies have failed. In some cases, doctors use brain imaging to monitor how a patient responds to treatments like deep brain stimulation, but even then, it is not used to diagnose OCD. Instead, diagnosis relies on detailed interviews, symptom checklists, and clinical judgment based on established criteria. In everyday practice, mental health professionals look at a person's symptoms, their history, and how they experience their condition. Brain scans are not part of this process because they do not yet provide the accuracy needed for diagnosis. They are expensive, time-consuming, and do not influence initial treatment decisions. If you or someone you know is experiencing symptoms of OCD, the best step is to consult a qualified mental health professional who can perform a thorough assessment. Brain imaging may someday become a helpful tool for personalized treatment, but for now, diagnosis depends on understanding the person's symptoms and applying proven clinical guidelines. So, to answer the question directly, brain scans cannot diagnose OCD accurately at this time. They are valuable for research and understanding the disorder but are not a substitute for a comprehensive clinical evaluation. Always seek professional advice for diagnosis and treatment options, and remember that each person's experience with OCD is unique.